Welcome to another edition of the Business and Personal Podcast, where we bring you closer to the people you do business with. And I'm real excited to have Cleamon Moorer on today. He's the CEO of American Advantage Home Care. He's been doing this for 3 years. The company continues to grow, and he and I have had so many great conversations offline. I thought, you know what, let's just get this stuff recorded because it's such valuable information that can help people out. So, Cleamon, first of all, thanks for joining me. How are you doing today?
Hey, I'm very well, Ryan. Thanks for having me, man.
So you're on the other side of it here today. You have your own podcast. Normally you're doing the interviewing, but you're going to be on the other side, and we'll talk about your podcast later. But
Wonderful.
first of all, just tell me about American Advantage Home Care, why you're so passionate about this. I know how hard you work at it, and
Oh,
why
yeah.
it fulfills you.
Hey, thanks, Ryan. Well, hey, American Advantage Home Care is a Medicare certified and Joint Commission accredited provider of skilled home health care services. So, Ryan, we have a wonderful opportunity of sending out nurses and therapists and medical social workers and even certified nursing assistants into the homes of homebound patients in Detroit and surrounding areas to, provide them with some skilled care. So whether it's exercises that they need from a therapist, or even wound care, or medication management, or colostomy, supplies, we're able to take real good care of homebound folks. And I'm passionate about it, Ryan, because I do believe that oftentimes the folks who are homebound, whether they are bedbound or have a chronic illness, sometimes they are forgotten, and we don't want anyone in Metro Detroit area forgotten. And, we're hopeful that some of the folks that are, homebound can one day, move around and live a more active and vital life, if at all possible.
And like I mentioned, you are growing. So tell people about
Yes.
your recent expansion and all the
Oh,
areas that you do cover right now.
definitely. Yeah. So our headquarters is in Dearborn, West Dearborn, downtown, Monroe Street. We have an office in Detroit. I'm really proud of our Detroit presence. In the old Boston Edison community, we have an office inside of Durfee Innovation Society. So that allows us to reach more inner city Detroiters. And that office, Ryan, is maybe 3 miles or so from Henry Ford Hospital. So it gives us great presence in the D. We're also downriver, so we have an office in Trenton. Uh, Trenton is still a blue collar, town and community, but our office is located right between Beaumont, Trenton, and Henry Ford Wyandotte Hospital. So we're in a really good nexus there of hospitals and doctors. And then our fourth office, we're up north. We have a small administrative hub in Grand Blanc, which is Genesee County. So, hey, Ryan, we're able to serve patients in Wayne, Oakland, Macomb, Livingston, Washtenaw, and Genesee, just to name a handful. And of course, Monroe County through our downriver office.
So,
Plans for, yeah, and some good
so
plans for expansion next year too.
That's great, man. So
Yeah,
obviously a wide area that you cover, and then there's a wide range of things that you do. And we've talked
yes.
about a lot of those. And one that I
Yes,
thought
sir.
was interesting is the physical therapy that you offer at home. And this is a good time of the year to talk about that. A lot of people get knee procedures or hip procedures, those big
Yes,
things done the end of the year when they're at their insurance deductible. So talk a little bit
absolutely.
about what you offer for the physical therapy at home.
Absolutely, Ryan. So yes, you nailed it. So for those folks that are looking to get the knee replaced or hip replacements and recuperate in the comfort of their home during the holiday season, we're able to send in therapists to help them adjust to the new knee or the new hip. We're able to train on some of the ADLs. So whenever it comes to getting around and moving around better with a walker or a cane, we're able to assist and get folks to understand what it means to not bear a certain amount of weight, on one leg or the next. Help folks from the nursing standpoint with, stitches and stitches removal. So we do the PT and the nursing, absolutely right in the comfort of homes. And this is one of our busiest seasons of the year. And also, I think it's important to mention, Ryan, that for folks that are recovering from COVID, who did have limited mobility and are trying to regain their strength, we're able to assist with the post-COVID rehab as well. And stairs inside of a home are a great device, great built-in device to help patients to be able to move around better.
No doubt about that. And I think, the last year and a half, it's always a hard decision when people have to decide to send a loved one to assisted living.
Yes,
And the last year and a half has made it an even tougher decision and put, I think, more of an emphasis on home health care and people taking a harder look of, can we still just have him or her taken care
right.
of at home? So
Absolutely
talk
right.
about some of those conversations that you've had with some of your clients in the
Yes,
last year and a half, and also like leading into the flu season and the
yes.
extra precautions you take to keep people safe.
Oh, Ryan, that's a good one. So we like to view ourselves as a partner to skilled nursing facilities, your nursing homes, and assisted living facilities. So by no means do we want to try to replace the value and the importance of those facilities. As a complement and a support system or an alternative for some families, home health care is a sought after resource or possibility. So, with that being said, being able to provide family members with some support, that they need in the home where they could feel and know for sure that their loved one has the absolute, undivided attention of a caregiver. So, in view of some of the nursing homes and some of the other facilities, sometimes those venues, Ryan, are short staffed, and a nurse could be on a floor and have to go to multiple beds. But with home health care, it's one bed in that home and it's a one-on-one relationship for the duration of the visit. So that helps families out a lot. Families are also able to call on that nurse or call on that therapist, after hours or during regular business hours to get additional support and training as related to helping that loved one. Home health aides, are able to come in a few times out of the week and provide baths and showers as well. So that sort of preserves, Ryan, not only hygiene, but that dignity, right? That dignity that a person needs to have maintained by bathing and showering in the comfort of their own home. We keep our clinicians safe. As you know, there's the vaccine availability as well as vaccine mandates. So as a healthcare provider, we have a high percentage of our current healthcare workers that are in compliance. And then for those that have a religious or a health exemption, we're able to honor their requests as well. So we do a good job, Ryan, of logging the wellness of our clinicians on a daily basis.
I can understand. I've seen some of the videos of how buttoned up some of your clinicians are when they come into the house. Like
You
it's virtually
got it.
impossible to spread anything.
Absolutely. N95 masks, face shields, and some of our, some of our older patients that may struggle a little bit with dementia or onset Alzheimer's believe that, hey, there's an astronaut in my house. We're like, nope, it's not an astronaut. It's a home health care worker of American Advantage who's nice and well protected.
Another interesting aspect of your business, I always thought of it as, taking care of the elderly, but there's such a wide variety of people that need home health care. And you and I were talking before we started
Yeah.
recording about reaching out to different corporations and helping with employees. Maybe someone gets
Yes,
injured on the job or whatever.
that's right.
Talk about those services and how they're every bit as much in demand as anything
You know,
else.
absolutely right. So when a person gets hurt on the job, and has to take sick leave, the assumption as the employer is that, hey, my employee has limited mobility, he or she can't work, so they must be at home, because they're on sick leave. And that's where home health care comes in, where, yep, the employee is at home temporarily while we're able to work on that employee and get them back to work. So it's an employer's nightmare, of course, to have a shortage of customers and or staff. You don't want a shortage of either one of those. So we try our best to keep folks working, strong. And that could be an injury from a factory, one of the big three, a person gets hurt, or a fulfillment center or warehouse. We want to do our best, Ryan, to help our employers in Michigan keep their workforce healthy, safe, and productive,
Give me a success story. You've been doing this for 3 years. I'm going to put you
Yeah.
on the spot here a little bit. Is there one that stands out? Maybe a situation that you came across and you're really able to help someone out that.
Well, there's a couple, I think of our, granted that Thursday is Veterans Day. We are a certified provider of home health care services through the John Dingell VA. So, and then all the other, VAs in the state of Michigan. So that's a really big hit for us, to be able to serve the veterans who have made the ultimate sacrifice for us, Ryan. That's big. We have what I like to refer to as moments of truth. In every industry and every company is going to have a moment of truth where you have to show exactly what the company is made out of, right? So as you scale, you try, and I'm going to get it to a good example for you, Ryan. As you scale, you try to bring forth interventions that are scalable, right? So I think with all transparency, it's good that if a patient says, I want to talk to the president, I want to talk to the owner, I got a issue or a challenge, we should make ourselves available. Now, that doesn't mean that if you have 100,000 patients, you're going to be available for all 100,000, but there's an opportunity to create a newsletter or have a town hall or a chat forum for folks, you should do it. So we had a client who, unfortunately, one of his favorite clinicians, right? One of his favorite clinicians decided to relocate. So she wouldn't be able to serve him anymore. So his favorite client called the agency and said, hey, if that nurse is out of state, if she's relocating, I'm going to have to find a different agency. And mind you, I never look at a patient as a number. Ryan, I think the patient that is in front of you is the most important patient, and you have a responsibility to find out what's going on, how you could better serve them. So having a dialogue with that, patient, I was able to persuade him to stay with us, to consider being served by a different nurse within our agency versus going to another agency for a set of nurses and clinicians. And he volunteered to provide a patient testimonial, Ryan, in our fall commercial. So we love Gus. We refer to him as Gus. So in our fall commercial, you'll see him, trust Gus. Gus knows home care, So I think that is a great testament when you have a person that is on the fringe of leaving your organization to do business elsewhere, but you're able to pull that person back in, and then they become an advocate, for your organization, and provide a testimony for how satisfied they are with you and your company. And that, hey, without an owner intervening and going into the house and having those types of dialogues, perhaps we would have lost that client, and perhaps he would be served by an agency that doesn't provide the same quality of care that we serve.
Yeah, I mean, there's no doubt people love seeing a CEO that gets his hands dirty or even
Yep.
wears the scrubs like you're
There you
wearing
go.
right now. Like you're
Gotta
deep
do it.
into it.
Gotta do it, right? Gotta do it, man. No doubt about it.
So, I want people to watch or listen to this podcast and learn more about you and the things that you offer. And, hopefully I can connect you to people that way, but I also
Yes.
really want to connect them to Home Healthcare Today,
My
your
man.
podcast. So tell me about, I know you launched that earlier this year. How
Yes.
often do you air it? How has it been going?
Wonderful, Ryan. So, hey, we host it bi-weekly. We take January and August off each year for planning. That'll be the sequence going forward. So we are, let's see, the next upcoming episode will be episode 18. And then we bring in, clinicians and specialists, community stakeholders from all over Metro Detroit. And we talk about some of those real important health themes. So the goal is to inspire and influence and educate people more about the value of home health care and hospice, as well as to provide information, much needed information about diseases, health challenges, and then some wellness tips, right? So the Home Health Care Today show is going very well, man. We do the YouTube show, as well as have the podcast version that's on just about every podcast platform.
So most people use Apple Podcasts. I know there it is right there.
Yes, sir.
So you're you're on any podcast platform someone listens to, type in home healthcare today in the search, and you should pop right up, right?
Absolutely, no doubt about it, Ryan. No,
They're
and
not
thanks
too
for the
far
inspiration.
behind. They can go back and listen to the ones they've missed and get all caught up here.
Yeah, and that's the binge nature of it, right? Where it's more so on-demand consumption nowadays whenever it comes to content. So you got to provide it.
Love it, man. So,
Yes, sir.
and then just to kind of close it out, anybody that is interested in hiring you for your services with a loved one or something like that, especially over the holidays coming up, what is the
Yes.
easiest way to go about that?
Easiest way, Ryan. Thanks so much, Ryan. They could call the office, 313-914-2296, or even our toll-free number, 844 for my AAHC. So that's 844-469-2242. And we'll immediately reach out to a primary care physician and get a referral for home health care. And if a patient doesn't have a primary care physician, we work with a number of visiting physicians, Ryan, all across Southeast Michigan. So we can get a doctor to go in and do a physical visit or to do a virtual telehealth visit to get that patient going.
And how quickly can they expect to be able to, whether it's telehealth or in-home, how quickly can you get someone in touch?
Usually, Ryan, usually within 24 to 48 hours, a doctor reaching out. But if we got a script, from a physician, we're able to, immediately send out a nurse or a therapist. So it's really up to the patient how quickly they want to be seen. And in all of the insurances that we accept, the major ones, Medicare and Medicaid, and just all of the HMOs, we accept a wide array of insurance plans.
Fantastic. Well, hey, it's like I said, it's awesome to see a company grow like yours has. It continues to grow through a pandemic. So
yes,
clearly
indeed.
You're doing something right, man. And look forward to continuing to stay in touch with you, and maybe we can update people later on, how things
go. Ryan, I love to loop back, man. Thanks, Ryan, for all the great work that you do to bring professionals in front of stakeholders and folks watching that need to know more about businesses and even the personal lives, so you have the business and the personal component, which is a great touch. We're at the beginning and end of the day, Ryan, we're all humans, and we're here to make the world better for each other and for the generations that will inherit the damage that we do. Yes, sir.
Well, I'm sure you're heading off to a day of a lot of different things you need to take care of here. But again, we appreciate you taking a little bit of time out. Thank you so much.
Right. It's always good seeing you, bro. Happy holidays to you and your family as well.
All right. You too.